Welcome to the Lentil Intervention Podcast, talking all things movement, whole food nutrition and environmental wellness with your hosts, Ben and Emma.
Hello everybody and welcome to episode 11. Coming to you from Auckland and Boonah in Queensland respectively are your hosts, Ben Heidelberg and Emma Strutt. Welcome, Emma.
G'day, Ben. Hi, everyone. Hope you're well.
Good. So, Emma, we have another, when I say international guest, someone that's not from Australia and New Zealand, which is exciting to have on the show. Who do we have?
We have Dr. Shireen Kassam. She's a consultant haematologist at King's College Hospital in London. Now, Shireen obviously likes to stay very busy because she actually took 4 years out of her specialist training to pursue a PhD, where she investigated the role of selenium in chemotherapy and cancer, which sounds absolutely fascinating. But on top of her busy work as a haematologist at the moment, Shireen is also the founder and director of Plant-Based Health Professionals UK, which is a non-profit organisation with a mission to educate health professionals and the general public on the benefits of plant-based nutrition for the prevention and treatment of chronic disease. She is also visiting professor of plant-based nutrition at Winchester University, where she runs the UK's first university-based course on plant-based nutrition. And she serves on the Doctors for Nutrition Advisory Council as an international advisor. So she's a very busy lady. So we are so appreciative of your time, Shireen. Thank you for joining us today.
Oh, thank you, Ben, and it's lovely to connect with you guys.
Shireen, tell us a little bit about yourself. We've got that fantastic CV that Emma's just read out, but tell us a little bit about your background in terms of what you've studied and your own personal journey to a whole food plant-based way of eating.
Yeah, for sure. Thank you. So I guess I've had a pretty conventional education, probably up until the last sort of 4 or 5 years. Went to medical school straight after A-levels and then decided pretty soon on that I was really interested in haematology because it bridges both clinical medicine with pathology. We're one of these specialties that see patients but also still look at our own pathology specimens like blood films and bone marrows, and I really like that connection. So when I steamed along sort of medical training and also incorporated a PhD, as Emma mentioned, which by coincidence happened to have a nutritional context to it, although it's only sort of latterly that I've more considered it in terms of my current interests. I became a consultant haematologist in the UK in 2000. So 20 years as a consultant specialising in the management of patients with lymphoma. So as you know, that's a cancer of the lymphatic system, and also doing laboratory diagnostics. So I look down the microscope and interpret laboratory tests and genetic tests, which all make up the final diagnosis for people with haematological cancers. So that's kind of my very conventional medical training here in the UK. But as an aside, on a personal level, I became vegetarian in 2001. I wasn't a particularly conscious vegetarian or particularly active in that space. I just had decided that I no longer wanted to or needed to eat meat, but carried on eating eggs and dairy. And then somehow in 2013, it's sort of, with discussions with family members and, the availability of, documentaries and books and things, I realized that, if I was really concerned about animals and animal welfare and the ethics of consuming meat, then really consuming meat and dairy and eggs was no longer fitting with my moral compass because of the harm caused to dairy animals and chickens. So I became vegan in 2013, really for the ethical reasons. And as you do, you sort of, need to find out how to eat healthily. And I came across the wealth of information supporting, 100% plant-based diet, so 100% vegan diet for promoting health. And at the time, most of this information was coming out of the US. And I thought, well, who's talking about this in the in the UK. And even though we've had quite veganism was coined by people in the UK, but really based on the ethics of veganism, and nobody was really talking about plant-based diets for promoting health. So that was the founding, really, and the reasons for starting Plant-Based Health Professionals UK, which, as you say, is a non-profit whose mission is to provide that evidence-based education for the UK audience predominantly, but also, for a broader audience on the role of using plant-based diets in clinical practice, something that health professionals had not been doing so much when we started back in 2017. But just, starting the organisation brought out a load of people who'd already been doing this and formed a broad network of multi-professionals that practice here in the UK, which has been an amazing experience, really. So, yeah, that's me in a nutshell.
Now, you've touched on kind of what you offer with Plant-Based Health Professionals UK. But something that might be of interest to the local audience here in Australia and New Zealand, because we do have a few health professionals that tune in, is your nutrition courses. So tell us a little bit about what they entail.
Yeah, so the course that I ran at Winchester University was, just really fortunate. Just a fortunate meeting with a like-minded individual who was a friend of a friend. She is the Vice Chancellor, Joy Carter, of Winchester University, and she happened to be vegan. So I set up a meeting and said, the UK needs a course, because people look to our university institutions as, the means of getting credible information, especially in the nutrition space where there's so much disinformation and people can say anything. So I really wanted to have a solid basis within a reputable university, and she was up for it, really. So I spent a year sort of developing an online course on plant-based nutrition, and we've now been running for a year. I run the course once a term. It's 6 weeks. I realized very soon on in the course that there was a lot of information crammed in 6 weeks, so I allowed people an extra 2 weeks at the end to kind of catch up and finish off and watch some of the videos again.
I was going to say it looks very detailed for a 6-week course.
Yeah, I mean, when I started, you start these things and think, 6 weeks would be long enough, and but there's so much data, and every time I run the course, there's more information to add to update it, and the beauty of it is that it is updated in real time, but you'll know for yourselves that the papers coming up now supporting plant-based nutrition in every aspect of the medical profession is vast, and as soon as you start also then talking about sustainability, it's a whole body of different papers and resources. So overall 8 weeks. It's a facilitated course, so we have questions and answers and chats going, and then discussions that people have to write about various sort of controversial topics like the role of added oil in the diet, or dairy, is it really good or bad, or is it just that it's not necessary, and things like that, the areas that we all discuss on social media all the time. So it's a facilitated course with myself and my fellow team member from Plant-Based Health Professionals, Layla Dagan, who's a nutritionist, and so far really successful, and we've certainly had people from Australia and New Zealand take it, and one of your colleagues, Mark Craig, is taking it at the moment, so you'll be able to get him on the show and get the lowdown of it.
Brilliant.
The inside scoop.
I was going to ask, because I see on week 6 one of the topics is a review of the UK, but also international dietary guidelines. And I think, am I right in saying that, whilst it's a course developed in the UK, so you're going to use a lot of more UK related data and information, but is this truly a course that someone from Australia and New Zealand will find relatable to themselves here?
Yeah, for sure. As you say, I often start off by quoting UK data, but really putting it in the context of international data sets and WHO data. And, diet is such a global thing. Really, it's a course that's applicable to everyone. And as I say, when discussing the dietary guidelines, I highlight guidelines from other countries as well. So yeah, absolutely, it's highly applicable for everybody. And I've not had any comments back from international participants that have suggested it's not applicable for them. And our most famous participant so far is Michael Clapper, and he wrote us a really, really great review. And so he found it applicable to himself and potentially his audience. So amazing. That was wonderful.
Look, and the cost is £350, which I think is relatively. I think it's a lot more affordable than some of the other courses available, and for how the amount that you offer, I think that's really good value. Now, cheeky question, and you can say you choose not to answer, but how does it stack up against some of the other, let's say, established plant-based nutrition courses out there? Why would someone want to choose this over another, let's say?
Yeah. Difficult for me to answer because I didn't do it as a comparator course to anything else. But I mean, on a personal level, the course that I've done or did first was the eCornell course, which is absolutely fantastic. But my main criticism is the affordability, because I wanted my course to be applicable to all sectors of the health professional audience, from nurses, physios to dietitians, etc., whose salaries may not be quite as much as physicians. So, that from that point of view, mine is attractive. I would say that I have focused it more on health professionals who are in clinical practice, and it sort of has a more disease focus. Unfortunately, we've got to the state where chronic disease is so prevalent that we're often seeing patients that are starting with chronic disease, and you have to unpick so many aspects of things that have gone wrong. So it's rather than sort of, just sticking on what you need to establish good health, it's looking at the data that's applicable to people who've already got chronic disease. So thinking about the typical patient that's going to walk into the GP surgery and what evidence they will need to feel comfortable to provide counselling or a direction on plant-based diet. So it is very clinically focused. It's very up to date. Each time I've done the course, I've updated it with, 2019, 2020 references, and will continue to do so. So it's continually changing in terms of the written content. So I guess those are the main things, that it really is very up to date, and it's focused in on professionals who are seeing patients with chronic illness.
Excellent. And you offer some CPD points for health professionals as well.
Yeah, so the British Society of Lifestyle Medicine has accredited it for CPD, and I've just recently got it upgraded from 15 to 30 hours because all the feedback said that people were spending far longer than I'd anticipated. So that's really great. And I don't know if you know anything about the accreditation through the lifestyle medicine colleges. Your Australian, I think it's Australian Society, isn't it, of Lifestyle Medicine, will be part of this global alliance. So myself and many others have obviously taken their certification, which means that you're certified as a lifestyle medicine physician. But in order to maintain that board certification, every 5 years and then 10-year period, you have to show enough CPD accredit accumulation to keep your letters after your name and your certification. And my course counts towards that. So, it will keep you going for 5 years on that sort of maintenance of certification, which is also excellent.
Yeah, and you also offer the Eat Well, Live Well online course. Is that more for the lay audience?
It is. It's a bit more of a sort of a starter to it, and a bit more practical. There's sort of, online cooking and recipes and that sort of thing, which is obviously not part of my course. And that's developed by one of our plant-based health professional members, Karen Lee, who herself is a retired ICU nurse, who unfortunately had a diagnosis of multiple sclerosis, and through her research into how to heal, she obviously came across all the evidence supporting nutrition and lifestyle. So she now runs what is a very successful and well-rated course, which recently has also been accredited by the British Society of Lifestyle Medicine. So yeah, that's a more sort of hands-on how-to and would be applicable to lay public, just to get some support. And she's got some live online support with that as well.
Excellent.
Brilliant.
Yep.
Well, we'll definitely have these links in the show notes, and we definitely encourage our listeners to have a look and perhaps consider registering. I think looking at the course content and listening to you sort of elaborate a little bit on what both these courses entail. Superb. I highly recommend it.
Thank you.
So. Yeah.
Thank you.
And also, you keep quite busy with your campaigns. You've got a couple of campaigns on the go at the moment, the World Nutrition Day and Give Bacon the Boot. So you do a fair bit of advocacy work under the Plant-Based Health Professional UK umbrella as well, which is fantastic. Tell me a little bit about that.
Yeah, no, obviously, I mean, the ultimate aim is to be able to influence policy and, rather than, just educating the already converted or those found their path to plant-based nutrition, which is kind of the easy side of things. We really need to influence policy here in the UK, which is pretty tough. So I guess my thoughts on how to do that had started off by, being associated with the right organisations, which of course include, Doctors for Nutrition in Australia, because, this isn't just a local movement, it's a global movement. Also to associate with relevant organisations in the UK, which include the British Society of Lifestyle Medicine. And we, as an organisation, we joined the all-party parliamentary group on food and health, which is sort of the way that our UK government structures allows people and organisations to have a voice and opinions which hope to filter through to government and those that can actually change policy. So we go along to the parliamentary meetings on food and health, and as you might have seen, I had the opportunity in February to present some data on plant-based diets and have that discussion amongst other representatives from Parliament. So yeah, and then the most recent, if you call it a campaign, it was really an open letter to the government that they put together with several other health professionals on sort of asking the government to really look at its health policy here in the UK, because our food systems are really not fit for purpose. We know that in the UK, more than 50% of what people are eating and putting in their shopping baskets are classified as ultra-processed food. Not even processed food, ultra-processed, which you guys know mean that these foods are so far removed from any of their starting, ingredients or foods, and they've got added chemicals and preservatives, and the cooking methods like frying and stuff are not healthy. So,
and I think it's important to note that this applies to the general vegan community too. Yeah, so it's across the board, isn't it?
Yeah, for sure. Yeah. I mean, I don't like using the word vegan as a term for somebody's diet pattern, because I always say it tells you what somebody is not eating. It gives you no indication of what they're actually eating. And Pringles, Oreos, they'll all count towards your vegan diet, but you will not be promoting your health in any way.
No.
But there's so many factors in people's food choices. Of course, education and cooking skills is one of them. But accessibility to healthy foods, the time to make the healthy foods, the cost of food, and we're realizing in this current climate of chronic disease, and also now more acutely the pandemic, that actually the inequalities in our health system and particularly our food system is meaning that the outcomes for individuals, for example, from lower economic sectors in our community, mean that they are doing less well from a health perspective. And this partly comes back to the fact that they don't have accessibility to healthy foods. And these ultra-processed foods are cheap, they're attractive, they are tasty, they're addictive, and that's what we're all reaching for. So so going back to the open letter, it's really demanding a a healthy food system for everybody, and addressing food justice, and at the same time addressing the climate impact of our food choices, because without a healthy planet, there will be no healthy people.
Absolutely. Couldn't say it better myself. And look, I just wanted to maybe open a can of worms here, but just talk a little bit more about, food injustices and inequality in the food system. I know in Brisbane, this is the capital city close to me, Shireen, whenever you go to the lower SES areas, you're completely correct. The accessibility to this ultra-processed food or fast food chains like KFC and McDonald's is a lot more frequent than if you go to the higher SES suburbs. So it's very multifaceted. Is it a similar kind of situation where you are?
Yeah, it's difficult to pick apart the factors, isn't it? But we know that socioeconomic status and social determinants of health account for so much of our health disparities and outcomes. So last year we had an update of the report called the Malmot report, I think it was, that was reporting 10 years after its initial report, and it showed that these socioeconomic disparities have got worse. So the poor have got poorer, the wealthy have got wealthier, and this means that health outcomes have also been drawn further apart, such that based on your postcode here in the UK, your life expectancy could be 5 years less than a neighbourhood with more affluent people, with better jobs, education, etc., which is a most terrible situation to be in. And austerity after the last recession has been blamed for a lot of this, and the UK government really did, promote these austerity measures. And these sort of, the socioeconomic disadvantage, of course, is also affecting ethnic minority communities more, because Asians, Blacks, and other communities are more likely to be in these lower social classes. So there's those two factors that have really been highlighted and also brought out in the current pandemic. And then there's many behaviours associated with lower socioeconomic status that include diet and nutrition. And as I say, people who are short of money, who are potentially working two jobs, who don't necessarily have the educational skills to understand how best to feed their families, who pick up on all the diet myths that are prevalent in social media and on the media, and are completely confused, make the easy choices for themselves and their families. And it's easier to go to a drive-through on the way back to work, or rather than cook from scratch, which takes time, effort, and potentially, if you're not doing it correctly, could cost more. I mean, we know that if you buy in bulk, and you can shop online and all those sort of things, you can really reduce the cost of your plant-based foods, essentially, cooking dried pulses and chickpeas and all that sort of stuff. But most people just don't have the time or the knowledge or the skills to be doing this.
It was just yesterday for me at work where colleagues could not believe that I was capable, which is a bit of a, it was a bit of a downer, but that I had the time to create and make everything that I was actually eating, because I had a soup that I had made, which had a whole lot of mixed legumes in there with the vegetables. I had my own bread that I made, and they couldn't believe. And this was on their way out to go buy the convenient food, convenience food that you speak of, because it's easy and it's accessible, but it's super ultra refined. But they couldn't believe that. And I think, what you say, the whole education thing, the whole awareness thing, similar to Brisbane, Auckland, where I am, south of Auckland is renowned for the same thing. Higher, there's a disproportion of the amount of takeaway institutions, the KFCs, the McDonald's, etc. Except, there is already evidence of the power of education and awareness, because there's a local community that fought against a new KFC opening, and they won. So these areas that are more susceptible are, in some cases, starting to become a little bit more aware of the impact. So I think, work like yourself, there's certainly a positive outcome from it.
Yeah, I really hope so. And, just some things have really been highlighted during this kind of lockdown period and the pandemic, because I don't know whether you saw an article that I wrote. It wasn't very popular, obviously, but, there was a time, we've had loads of companies deliver food to us here in the NHS and at the hospitals. And of course, we're really grateful for, donations to people who are working on the front line. But, there was one day when Krispy Kreme delivered a whole load of donuts to the wards and areas in the hospital and things. And I just, I know people like a treat, but this is just what our society has got used to, that it's okay to deliver, hundreds and thousands of donuts to NHS hospitals that are fighting illness and are full of people with chronic illness. It's just complete, we've got it just all the wrong way round. We'd love to have fruits and vegetables and healthy snacks, but really Krispy Kremes, and then you have to think, well, why? The NHS is the biggest employer in the UK, and Krispy Kreme gets brownie points for free donuts.
It's the biggest oxymoron. Yeah, it's like McDonald's sponsoring the Olympics or Coca-Cola sponsoring the Soccer World Cup. It's incongruent.
Yeah, all the ham and cheese sandwiches being served on the cancer wards. Class 1 carcinogen.
Now, speaking of cancer, in your latest, your weekly review newsletter that you published through the Plant-Based Health Professionals UK, you talk a little bit about the latest American Cancer Society guidelines for diet and physical activity for cancer prevention. And already, there's a lot of things you've mentioned right now that's in this article. Is there anything in particular that's, with this article that's new, that's a new revelation, or that is highlighting something super key that we really need to get the message out?
Yeah, and it would be good to link to that, actually, because I think it's a really great resource for, one of our top killers. 1 in 2 of us are born after 1960 here in the UK, and I'm sure the stats are similar where in Australia and New Zealand, are going to develop cancer in their lifetime. So, this is really a key document for everyone, and it's really written in a very sort of easily digestible fashion. So American Cancer Society guidelines updated. And I found it really useful, and I think it just reminds me that, it's not about individual foods and nutrients. If you eat broccoli every day, that's not going to be the be all and end all of your cancer prevention strategy. We have to concentrate on the whole diet pattern. And, as much as I'd like to say it had to be 100% plant-based, that's not what the science says. The science says that the more you get towards a plant-based diet, the better. But, you probably can incorporate 10 to 15% of animal products in your diet, although that is a personal choice. It's not that it's necessary. And that this document clearly says that studies on vegetarian and vegans show a lower incidence of cancer, full stop. So it says that in one of the final paragraphs. So that's great to see in a kind of mainstream document. But for me, it was a nice reminder of other sort of commonly asked questions by my patients. So it really goes into depth. It talks about, what about acrylamide? When you eat French fries, or acrylamide in coffee, for example, does it cause cancer? And the bottom line is there isn't enough data yet. It talks about organic food, and I think we're being, the data, there's only 2 big studies looking at the impact of choosing organic versus non-organic. And there is a hint, quite a strong hint actually, that choosing organic might reduce the risk of non-Hodgkin lymphoma, which is obviously the disease I treat. But it reiterates, it's still better to eat lots of fruits and vegetables rather than be hung up on making sure it's organic. So there's all these little questions that people ask you all the time. It even covers a paragraph on juicing, actually, which I thought was quite bringing up to, talking about, can juicing, prevent or reverse cancer? And, it says there's just not enough data, so I think it's useful because it really does answer all those questions that you and I get asked all the time by patients or people concerned about their health. So,
and it includes
I
soya
think
foods as well, which is another common one.
It does. It does. And, it clearly, I think it's a bit lukewarm about soya, but it clearly says that there's data supporting it for some aspects of cancer prevention. And there's certainly no evidence of harm. So that relates to sort of minimally processed soya foods like tofu and soya milks, etc., rather than the protein isolates, which there's less supported data.
Yes.
Yeah. No, so it's a really great update for us all, actually.
You do absolutely fantastic weekly reviews. I think your social media is probably one of the best.
We need to take some notes there.
How do you find the time to do this every week on top of your work with plant-based health professionals, on top of your actual work as a doctor in the hospital?
Yeah, well, I have
must
to
be
say
those
that...
Krispy Kreme donuts keeping it going.
Yeah, must be. Well, I have to say that when I started, I within a few weeks of calling it a weekly update, I realised what a big mistake I'd made that I called it weekly, because it meant I was meant to be doing it weekly. So so I should have really said regular
Fortnightly
review or whatever. But actually, it's I found it really useful. So yes, as you say, I provide a weekly summary, which goes first on my Medium account and then soon gets put onto our website and is accessible on our social media sites. A weekly review of relevant studies supporting or even maybe not supporting plant-based nutrition for health and its use in preventing chronic disease, and it's just been a really great way for me to keep up to date on a personal level, because you find that you sort of you don't keep up to date with things unless you have to, and you don't you might read an abstract and not the finer detail unless you're having to write about it or speak about it. So it's a really good way for me as a course facilitator just to keep up to date with the science. And as I said at the beginning, there's so much science coming out now, which is great to see, and it's motivating for me. How do I fit it in? I don't know. I guess you find time for things that you feel is important. And for me at the moment, it really is a passion, and I don't get paid to write that review. It's just something that I feel that's necessary, and it benefits me, and if I hear that people are reading it, it's highly motivating. I'm an early riser as well, and I'm lucky my husband gets up a few hours later, so that frees up a bit of time in the day. So I get up early, get my work done. I also have a very long commute to my day job in London, actually, so a bit of time on the train to look at journals and stuff is useful.
Yeah. Are you able to talk to your patients much about nutrition?
Yeah, it varies, and I have to say, in my day job as a cancer doctor, I mainly have my discussions with those that I think are open to it and ask about it. And you probably know from your own practices, people have done their own research and either have fixed ideas or not about plant-based diets. Unfortunately, the way the NHS works and the type of patients I deal with, it's quite overwhelming to be able to fit in all the information you need about, the diagnosis, the prognosis, what treatment you're going to need.
In the short time that you have.
Exactly. So I don't do as well as I can, but I point people to the resources, and I hope that they will take the time to delve into it a bit more deeply. The trouble I have is that people along their cancer journey meet a lot of our team members, so my other colleagues, they may go into clinic rooms to see them when I'm not there, or the clinical nurse specialists, our dietitians, our physios, and the whole diet thing is just not consistent. We know that health professionals in general advise their patients or clients in a fashion that relates to them. So, I always say that, I don't drink alcohol, so I'm very comfortable saying to my patients, alcohol causes cancer, whereas I know for a fact that my colleagues who choose to drink alcohol, which is, the usual behavior, and most health professionals will say, oh, well, everything in moderation and follow the government guidelines. So it's kind of, people who are likely, who exercise regularly themselves, are more likely to tell their patients that exercise is beneficial. And, these studies have been looked at. So the physician's health behaviors really influence what is told to the patients. And because a patient along their journey meets so many health professionals, I think, I suspect we're not as consistent as we should be, and I suspect I'm not doing as well as I could do. But, I do my best, and those that are open to it get all the relevant resources. And the main thing, as you know, in behavior change is that people have to be ready to change.
Yes.
And you have to meet them where they are in their journey of change, and support them as much as you can through that. So, I could do better, do the best I can, and point them to the right resources.
But it's an interesting what you say is a common theme across a lot of health professionals, even Dr. Mark Craig, who I spoke to just the other day. You don't have the time, so the few health professionals that are finally understanding the impact of the right nutrition and lifestyle choices in general, they just so you now have this information, but you just don't have the time. And in some cases,
not set up.
Yeah, in some cases, your practice might also not be too keen, on you pushing in a particular direction. And this therefore highlights the valuable resources that are created, such as yourself, that you do. And I think it's hugely commendable, and it's so important, because if you don't have the time, here's a piece of paper, here's a website, here's the link, here's a newsletter you can sign up and just do it yourself. And but it's a shame, because it feels like something needs to change, because there's a change happening, but it doesn't seem to be going right through to the end user who needs that.
Absolutely.
Yeah.
I think preventative strategies in the UK have really been shortchanged. Public health, prevention. The patients I'm seeing, their therapies are compromised because they have heart disease, diabetes, they're overweight. And you know what it's like to have to support an individual to really change their health behaviors. You can't do it in one or two sessions. People need social support. They need people to guide them through their behavior change, because they're so far removed from what is healthy. How does somebody who eats mostly processed food suddenly go whole food plant-based? It's just completely unrealistic, isn't it? So, health coaches and those sort of individuals are really key to this, but there needs to be resource put into this.
Yeah. Well, you're definitely doing your bit for that with Plant-Based Health Professionals UK, so thank you very much for that. So moving forward, are there any big plans on the horizon for the organisation?
Always plans, really. I guess the changes we made this year have been forced upon us a little bit, because I don't anticipate that we can have any live events at all. So we've had a rapid shift over to doing fortnightly webinars, and that's available to everyone. So the live webinars will be available to everyone for free. We ask for donation if people can, and then the recorded ones are obviously for our members only, because I guess I should have said we are a membership organisation, so there are a few more perks for those who have paid the small amount and joined us and to support our work. We've been doing webinars, which has been a great success. Actually, we've had at least for each webinar over 200 people sign up. So I think that's going to be our sort of focus for our sort of health professional education for this year. We've got lots of plans for sort of more fact sheets, which you need a fact sheet on virtually everything, don't you? So we've got lots more plans, and in the sort of rare areas like feeding children, and we've already got our pregnancy one on the website, and things. And then on a personal level, I would like to sort of expand the stuff I'm doing at Winchester if time and resources allow. So, the kind of grander plan would be amazing to have sort of a postgrad certificate or even an MSc, sort of more including more of lifestyle medicine, but that's sort of work in progress really. But I see them as being an organisation that would support that. So that would be good. And then we've got some little bits of funding. I should have said that actually our webinars are funded partly by ProVeg, which I don't know if ProVeg are they active in Australia as well?
Well, our 2 episodes ago, we had Yasmin Dabu.
Oh, yeah, of course you did. And obviously I know Yasmin and her husband, Andrew. Yeah, cool.
Yes.
So you've heard all about ProVeg. Yeah,
Yes.
cool. So we're working with them for that. And then we've had a grant from Veg Fund, who've supported our work before, to sort of to create the equivalent of the UK kind of 21-day plant-based challenge, kind of, as it were, because what we find that GPs are asking for or would find useful if patients have a UK supported plant-based course to kind of make the shift, because as you say, the best we can do is give some information and a few snippets on where to go and find more information, but we're creating an online kind of email-based 3-week supported supported kind of guide to transitioning to a plant-based diet. So there'll be recipes, meal plans, videos, that sort of thing. So team members are working on that. So I think that would be a useful resource, because as you say, we really do need a UK resource, and we're really going to make sure that it is also applicable for all the different communities within the UK. We have, lots of South Asians and Africans and Turkish population, etc. And their foods are very different. So we're going to really make sure that we've got recipes that are accessible for all groups represented in the
Amazing.
UK. That's good. That's so important, because the whole food plant-based movement is fantastic, but it is
segmented in some
it
ways.
is, and it's still quite a white space, I suppose, and so making it more inclusive, that's so important moving forward.
Yeah,
I agree. And the fact that traditional diets in India and Africa, they're all predominantly plant-based, but the same thing has happened. They've shifted over to westernized diets, and we don't understand how to help them transition back, because we don't understand what their favorite foods are or whatever. So we realise we also need to do better as a group. We're quite well represented on the South Asian front, but we haven't reached many other communities. So we will do our best to do that.
That's brilliant.
Oh, wonderful. Well, you'll have to let us know when that's up and running, so we can let everyone know about it over here.
Yeah.
Great. So are there any kind of, we're just mindful of your time, we don't want to keep you for too much longer, any kind of top tips you can leave us with for people that, you might have piqued their interest, but they're not fully immersed in this space yet? Most important things to concentrate on, or, run us through a day, or just general kind of tips and tricks for someone looking to get into this space a bit more.
And to be more healthy themselves.
Yes.
Yeah. So I think, it's always about doing better and not having to be perfect. So as I say, at the moment, I can't say as a doctor you have to be 100% plant-based, but you can be really healthy being 100% plant-based. So the closer you get, the better. And it's all about focusing on eating more fruits and vegetables and making that your choice of snacks. So here in the UK, only 28% of adults actually eat 5 portions. So I think the best thing you can do is really concentrate on eating more fruits and vegetables. I think, making easy swaps, like your favorite meals, rather than using meat for your bolognese, swap in the lentils, or you'll use tofu for curry rather than chicken. So, take your favorite meal and, a few times a week, make them plant-based. And if you're going to choose anything for breakfast, make it oats and add your source of omega-3 fats, which is your flax seeds, and a portion of berries. And that's a really great way to start your breakfast. And if you want to top up your fruits and vegetables and micronutrients, and having a smoothie a few times a week is a great way to sort of load up on that, and also great for athletes to add more calories and nutrients. You can make it calorie dense or less calorie dense depending on what you put in it, with nut butters and avocados and things like that. So those are the sort of top things that come to mind right now, and obviously not to underestimate the impact of all the other lifestyle practices, because it's not just about nutrition as much as I would like to say it's just diet, and you will live well just with a healthy diet. We know how important physical activity, mindfulness, other stress relieving activities, avoiding alcohol and smoking also are. So and small steps. The good news is that you can reverse the damage, and if you're unlucky enough to already have a chronic disease, or you can become healthier over time, even if you haven't been all that healthy up to now. So it really is never too late, and we're forever reading about even older people that have shifted over to a plant-based diet and gained enormously. And plant-based diets for elders is a really exciting area, I think, where there's less data, but this just in the last couple of years there have been some really supportive papers, and I'm going to cover that in this week's weekly review as well. So I think that's
excellent.
a really interesting space. Yeah.
And one of our recent guests was Grant Dixon, who had a heart attack at a very we said young age, in his late 50s, but going whole food plant-based has certainly improved his health dramatically, and his ability to exercise now is he's doing so much more. So
setting
absolutely.
PBs in his 60s.
Yeah, that's right. But and also not forgetting the importance of sleep. When we're talking about the lifestyle choices. But Shireen, you the key thing what you're saying here is it does not need to be an all or nothing. It doesn't need to be, does that mean I have to give up everything? Sounds too hard, or
Absolutely.
I don't know when to start or how to start. What you're saying is start the journey. 10% is better than 0. 10% will lead to 20%. It'll lead to, so, and then if you have the slip ups, or if you have the, whoops, I had by our definition, a poor meal or a naughty meal, or however we want to describe it, it's okay, because it's the bigger picture. So that's the message you're really pushing, is start a change, start somewhere, and make a difference to what you're currently.
Yeah, for sure. And I think the other really important thing, as you guys will know, is knowing your why. You need to know why, and to come back to that every day.
You need conviction.
So before you do, yeah. So for me, it's the animals, and that will never shift me from, eating a vegan diet. But does it keep me eating healthily all the time? Probably not. But so I think you really need to have your motivation and come back to reminding yourself why it's so important for yourself and your loved ones as well.
Yeah, absolutely. 100%.
Shireen, thank you so much. It's been such a pleasure having you on the show and getting it's nice to get an outside perspective. A majority of our guests have been local, Australia, New Zealand, and we'll continue doing that. But it's nice to every so often get an outside perspective that, it's big picture. We're all on the same journey. It's not isolated to a particular part of the world or a particular population or demographic or whatever. And, the work that you're doing is incredible. The amount of resources, information that you're offering to the public. I really think this plant-based nutrition that you're offering, this course that you're offering is superb. And again, if someone wants to upskill or gain some confidence, there's that initial course, learn how to cook some basic meals and get on the journey, and then get more serious if you want to with a more serious course. So, it's been brilliant having you on the show. There's so much we're going to share in terms of links and so on with our notes. But thank you so much.
Thank you, Shireen.
No, it's been an absolute pleasure talking about my favourite topic. So thank you.
Thank you for listening to the Lentil Intervention Podcast. If you found this interesting, make sure you subscribe and share it with your friends.